Right, so I've had a lot of people still questioning, even though there was the hot mic situation, people are still like, but what if? And that's fine, I completely understand. But here's the thing, this is all you need. This right here, it's all you need. Fauci and a few other doctors put this out back in March in the New England Journal of Medicine. This is peer-reviewed. You see, doctors can, or anybody, they can go and say whatever they want on TV and fearmonger and do all these silly things and what if, all they want. But when it comes to publishing a peer-reviewed journal article, you can't just be fudging things because other doctors are putting their names on it, and this is going to be something in the records forever, And so they take this a lot more seriously, and they have to actually use evidence and actually break things down and say, okay, this is what we're looking at. And so it goes through, the latest threat to the global health is the ongoing outbreak of the, Kool-Aid 19, and was recognized in December. It was rapidly shown to caused by the novel Kool-Aid. Okay, let's continue. But they go on to say that they tested this many people, blah, blah, blah. But here's the thing. We know that early on, they were only testing people that were symptomatic, which makes sense. I mean, that's what you're going to do. So they were getting a case fatality rate of approximately 2%. In addition, an article in the Journal of Guan reported a mortality of 1.9% among only 1,099 patients. But see, we knew that they didn't have enough people tested to actually put out a number. And so when numbers started coming out, they realized that the case fatality rate may be considerably less than 1%. This was back in March, y'all. So Fauci has known about this. This is his article. This suggests that the overall clinical consequence of the Kool-Aid 19 may ultimately be more akin to those of a severe seasonal flu, which has a case fatality rate of approximately 0.1%. Yeah. Compared to SARS, which had a much higher rate, 9 to 10%. Ebola has like 70%, or I mean, this last Ebola, it was bad, 70% or something. But this is really all you need. This is absolute proof. This is the medical journal article that is peer-reviewed by other doctors. Technically, this was all the way back in February. That's what I was thinking. This has been out for a while. February. They've known this. Yet they have locked people away in their houses, turned neighbors against neighbors, friends against friends, turned people into just complete goofballs, wearing masks and doing all this craziness, when they knew darn good and well that it was 0.1% at the high end. At the high end. Whenever you actually do the math, even with the fudge numbers that they have given us, it's more like 0.01% of the population. So I guess that still makes sense. It's still, if you get it, you have a 0.1% chance of dying. And, there's a lot of questions on if it is affecting certain ethnicities differently than others. And I've already gone through that. The answer is kind of. The reason that we are seeing a lot more African Americans get it and die from it is due to the fact that they have exponentially more people with diabetes. And diabetes is absolutely something that puts you at a higher risk of succumbing to this. Diabetes, asthma, heart disease, COPD, all of these things. And so technically, is it like targeting them? No. It's just when you're already immune compromised, that's what's going to happen, especially with diabetes. If you know anybody with diabetes ravages your body. It really does. And that's something they need to be focusing on. People need to be focused on eating better. They've already put out that vitamin D is something that almost every patient that has been tested, they're low on vitamin D. But yet they're telling you to stay in your house. You get vitamin D from the sun. You see, so, I mean, you can make whatever you want out of that. But you see how all of these things are contraindicated to if you're really wanting to stop this? People need to be going out in the sun and eating fruits and vegetables and drinking lots of water. All of these things you need to be doing. But instead, every single day that I've gone to the Walmart and all these other grocery stores, I go there just so I can do a little head count of what kind of silliness they're doing. The fruits and vegetables are flourishing. But yet you go to the frozen aisle and there's no pizzas and limits on cheese, eggs, milk, bread, and pizzas. And other frozen dinners. Doesn't that tell you something? It tells me a lot. It tells me that people aren't eating healthy. They're just sitting at home eating a whole lot of ice cream and pizza. And that's just not helping them. You see what I'm saying? But, that's just kind of funny to me. Actually, the New York Post put out a good article about that. That's funny to me how we have a population that we've never seen this kind of obesity. Let me see, what was it? New York Post? Yeah. Here we go. The obesity rate that we have and the diabetes and all of these things is rampant in the West. But yet all of a sudden people care about their health by wearing a mask. You see how silly it is? I mean, just think about it. Oh, this stupid thing. So, coronavirus crisis could soon disrupt U.S. production of beer and soda. That's not the one I wanted. It's showing that being overweight. New York Post. Dang it. I guess it's not going to come up. Obesity. They might have taken it down because, you can't say things like that and hurt people's feelings. Here we go. America's junk food diet makes us even more vulnerable to corona. And that's why we're not seeing this ravage through Venezuela and Brazil and even Mexico or these places. They don't eat this. They eat it, but nobody can compare to the horrific way that the U.S. eats. I mean, we literally practically eat no real food for the majority. I mean, we eat everything that's been processed and fried and sauce and all of this stuff. I'm guilty of it too. I'm not judging anyone. But this is something that absolutely contributes. And I'm glad that they put this article out. It's our favorite vice and true to our national pastime. Here of the land of plenty for now. Americans love to overindulge. We eat too much, drink too much, snack too much, sit too much, then rely on marvels of modern medicine to repair our battered bodies. Exactly. And this makes us easy prey for a brand new infection like the Kool-Aid virus. For anybody that doesn't know, I'm not saying the real name because they like to censor that. We left ourselves vulnerable to this epidemic. Our healthcare system would not be so overwhelmed right now if it wasn't for our already overwhelmed preventative chronic illnesses. About 75% of the $2.2 trillion that we spend on healthcare each year goes to treat chronic illnesses. And 40 to 70% of those illnesses could have been prevented. Absolutely. Take cardiovascular disease and stroke. 2018 United States shelled out $329 billion to treat them. American Heart Association calculated about 80% of those cases, $263 billion, were caused by poor diet, lack of exercise. Oh my gosh, I can't talk today. I cannot talk. Lack of exercise, alcohol use, and obesity. This also affects 300,000 premature deaths, every year. That's absolutely a fact. Now, this is actual journalism. Thank you, New York Post. Actual journalism. But that's all you need to know, y'all. It's just really funny to me how everybody's so technically unhealthy, but yet a virus comes along and people are all of a sudden concerned. Come on now. Eat fruits and vegetables. Don't eat this. You can eat it every once in a while. Get healthy. And then you don't have to worry about this crap. Alright. So, and you see, they put this on everything. Every single thing you go to. You go to YouTube. There's a coronavirus thing at the top. Oh, crap, I said it. You go to every single site that you go to. There's some type of coronavirus thing at the top. Click here. Look at this. Oh my gosh, it's so terrible. Look at all these red numbers. Look at these red countries. It's silly. It's straight up silly. Could you imagine if they put Kentucky sees the highest spike in coronavirus after lockdown protests. That's such a lie. I knew that they were going to use these protests to make some new cases. Anyway, I'm not going to get into all that. Either way, it's still 0.1%. So you can get it, doesn't matter. Yeah, you might die, you might not. And does that mean you're going to be locked up in your house or close down your business and lose your entire business? Or stop visiting friends and family? Stop worshiping at church with your friends and family? Obviously, you can worship at home, of course. But I'm not going to get into, I'll get into that in another video. But they're definitely targeting churches. Anyway, y'all can share this with your friends and family. I'll put the link to the article, but you can just Google it. New England Journal of Medicine and Fauci, and you'll find it. So, they're just lying to our faces. They know. Anyway, y'all have a wonderful day. Like, share, and subscribe.